I'm Dan Reznicek from Pacific Northwest Urology, and today I'm going to be talking about Interstim. What is Interstim? Interstim is the brand name for a product made by the Medtronic company that provides sacral electrical neuromodulation. This is a product designed to treat overactive bladder and non-obstructive urinary retention. It also treats urgency and urgency incontinence. It is typically used after medications fail to treat these symptoms. How does it work? The bladder is composed of a muscle that sits and stores urine in your pelvis. In the lining of the bladder and the muscle itself, there are sensory components that tell you certain things, such as when your bladder is full and when you need to urinate. The bladder then sends signals up to the brain through several different nerves. These nerves are in the pelvis in the sacral nervous plexus. They travel up to a hole in the back called the sacral foramina, and predominantly most of those nerves go through the S3 foramina. They then head up to the spine and up to the brain. Once your brain receives these signals, it then coordinates and tells your bladder what to do. In certain conditions such as overactive bladder, these nerves are overactive within the bladder and send signals to your brain way too often. Sometimes they may even be sending signals so strong that your brain cannot control them and your bladder starts to empty on its own. It is not completely understood how sacral neuromodulation works, but an electrical stimulus given at the S3 nerve appears to modulate the response from the bladder to the brain. This electrical response decreases the feelings of urgency and the sensation that your bladder is full. Interestingly, sacral neuromodulation also helps bladders empty better in non-obstructive urinary retention. We're not sure exactly how this works and how it's able to treat both, but it has been very effective to help treat patients with both of these scenarios. Typically, if a patient is interested in this procedure, we do a test run in clinic. The simplest test is called a peripheral nerve evaluation. This is an in-office local anesthetic procedure done right here. The procedure itself takes less than 30 minutes. Like I said before, it's done under a local anesthetic. It uses several acupuncture-sized needles to find the foramina with the use of fluoroscopy. Once the location is determined to be in the correct location, we then put a very small wire in and connect it to a generator to provide an electrical stimulus. You go home and try this out for about a week to 2 weeks and let us know if it's improving your symptoms. This temporary wire is hooked up to a generator that you can control via a remote. So there are different settings that you can try and see if it helps improve your symptoms. If you come back and you've got a greater than 50% reduction in your urgency, your frequency, and you're overall happy, we then move on to a full implant. This test phase is just performed to see if it works because sacral neuromodulation doesn't work for everyone. But for those who it works for, it works great. It works for 5 to 7 years, and there's no taking medications, which is fantastic. If it's not effective, there's a very small wire, it gets pulled out, and you're on your way. We move on to trying something else. So there's not a lot of risk involved in trying a peripheral nerve evaluation to see if Interstim is right for you. Following the procedure, you'll have a small plastic bandage on your back that helps protect the wires and prevents them from being pulled out. While that's in place, you can't shower. You can wash your front and self-bathe, but we don't want to get those wires wet while we're testing it because it'll short-circuit the device. We generally recommend light duties for this first week, not because there's any risk, but because we don't want those wires to be pulled out of place. If your peripheral nerve evaluation went well, we do a follow-up procedure called a full implant. This is performed in much the same fashion. However, the leads that we place are a little bit more permanent and will not move once we place them in the correct location. We will also then place a generator that's placed under the skin that can provide an electrical impulse for the next 5 to 7 years. This again is a fairly quick procedure, generally takes under 45 minutes, especially if the peripheral nerve evaluation went well. We know right where to go from before, and we're simply then placing wires and plugging it into the generator. Following this procedure, again, you'll have a small dressing, but again, in this situation, there will be nothing outside of the skin. and you go on your way. You'll be able to shower in 2 days and be able to bathe in 3 to 4 weeks. There are no weightlifting restrictions, and generally we say don't do anything very active for the first few weeks, only because we don't want you to pull that lead out of location. We generally also recommend that you don't submerge in a tub or a bath or a pool until the wound is completely healed. In some individuals, we choose to do a different two-stage procedure, a stage 1 and a stage 2 Interstim placement. These stages are quite similar to the peripheral nerve evaluation and the full implant. There are some subtle differences. But if you're scheduled for a stage 1 implant, I'd like to go through those steps right now so you can understand why we do one versus another one. A stage 1 implant is done in a similar fashion to the peripheral nerve evaluation. Sometimes with this procedure we use sedation in addition to a local anesthetic to make it slightly more comfortable, but it's performed the same way. You come in here to our clinic, you lay down in a face-down position, and then we use acupuncture-sized needles to find that S3 foramina. We're also using fluoroscopy, or the X-ray machine, to make sure we're in the right location. Once we've confirmed the right location, we then put the permanent lead in this location. Now, this lead can be removed at a later date. However, again, it doesn't simply pull out like our temporary lead in the peripheral nerve evaluation. In some individuals, especially larger individuals, that temporary lead might get pulled out too easily, or in different situations like non-obstructive urinary retention, it sometimes takes longer to get the right results. So in that situation, we like to put in the more permanent lead that's not going to move around. Now, like I said, typically it's done under sedation, and it's not that different from the other procedure. The only difference is we actually tunnel the wire to where the generator will be placed at a later date, and then place a temporary wire out the other side of your back to provide a long distance to prevent infection from being able to get all the way to where the generator is located in 1 week. These temporary wires then come out and are hooked up to your temporary generator to trial while at home. As you can see, these leads look a little bit different than the ones in the peripheral nerve evaluation. They just have these plastic little pieces on them that prevent them from being easily removed. Now, if the procedure is not successful, we can also remove these. However, we typically do that again under sedation with local anesthetic. It's a little bit more difficult than simply pulling it out, but it's not a significant procedure to remove the leads. The trial with the stage 1 implant is very similar, again, to the peripheral nerve evaluation. You come back in clinic sometime between the 1 and 2 week period, and we evaluate your symptoms. If your symptoms are improved by over 50%, then we proceed to placing the full implant with that generator. That generator, again, is performed under generally a sedation procedure. Some patients have to use a general anesthetic, but the vast majority of time it's under sedation with some local anesthesia. During that procedure, we remove the temporary wire, and then we just place the generator. Your leads are already in the right location. So the second stage, a stage 2 implant, is actually a very quick procedure, generally taking less than 20 minutes total. Once the generator is in place, it can then provide electrical stimulation for a 5 to 7 year period in most patients. If the generator ever does run out, we then simply replace it. And replacing this generator, this very small device, is a very quick procedure. We simply make an incision on the old one, remove it, and place a new one. Risks include bleeding, infection, failure to treat your symptoms, and pain. Pain is generally very mild in nature from this procedure, as it's very small incisions. However, some individuals can report an electrical stimulus or electrical pain afterwards, although that's very rare. Overall, our patients that receive Interstim have been overwhelmingly happy. It's a great procedure. People come in with very severe urgency, incontinence, or even retention, and they go home and within several weeks, they're drastically better. And the great part about it is there's no medications. Rather than just treating the symptoms, it's treating the electrical stimuluses and actually making your bladder function more properly. Now, once the generator runs out, that effect wears away. It's not fixing the problem permanently, but it can provide a long-lasting, a very long-lasting solution.